Hi, I'm Connor Nichols. I'm one of the emergency medicine faculty. This is Tori. We're going to do some gallbladder ultrasound today. Today I have this probe, which is actually good for getting between the ribs if the gallbladder is higher up, but you can also use the larger curvilinear abdominal probe, which is usually what I use. When you're getting ready to do the gallbladder ultrasound, you want to have the patient sitting up at about 30 degrees because you're trying to do everything to get the gallbladder to fall below the ribs. Typically I start out with the indicator on the probe. We're obviously an abdominal preset, but the indicator on the probe is towards the patient's head. And I'll start off in the epigastric region, so it's about as high up as I can go, with my wrist kind of cocked up, because I want to bring liver into view on the screen. So once I bring liver into view, then I kind of scan around the costal margin, and usually what you'll see is the portal vein first. And what I want to do is I want to get a sagittal view of the gallbladder, which is not necessarily sagittal on the patient. So you want to get a sagittal or longitudinal view of the gallbladder. So you want to get the most elongated view of the gallbladder on the screen, and you want to make sure that it connects to the portal vein, because your portal vein is your landmark for gallbladder. So on here, I can definitely see it. I can see a little bit of the median lobar fissure, and I can see the gallbladder there. So you want to get the most elongated sagittal view. Sometimes that you can use their breathing, and again you can turn them on their left side. And so once you have that, you want to freeze that, and you want to save that, and you want to measure the wall. When you measure the wall, it needs to be on the anterior side, or the side of the liver. You can measure the wall in transverse or longitudinal, but you want to measure it definitely on the anterior side, because there's something called posterior acoustic enhancement. Then you want to get a video of yourself panning through in a longitudinal. Save that, because you want to make sure that you're seeing everything, you're not missing any stones. Once you see that, then you can turn transverse. I use 0.4 centimeters or 4 millimeters for common bile duct and for wall measurement. You will see things that are larger, like some of the books will say up to 0.6 is okay for common bile duct. You can also see 0.1 per decade, like an 80-year-old could have a 8 millimeter common bile duct and it could be normal. Obviously, you know, if somebody's had their gallbladder out, they can have dilatation. There's lots of reasons, but I just use 0.4 across the board for everything. So then I start over in the same epigastric region, and now the liver is much more visible. And then to get the common bile duct, I'm going to have him take a deep breath. Hold it, and I'm going to look for, so I believe it's going to be here. I'm going to measure outer wall to inner wall. Some people say outer wall to outer wall. The other thing that I do that a lot of people don't do is I will take a quick look at the kidney as well, since you're already right upper quadrant. If there's stones in the gallbladder, you want to make sure that the stones are mobile. So if I see little stones, and now I'm looking with him turned, and I see the stones in the neck, and they're still right in the neck, they're not in the fundus, then I'm going to have him roll over more. If you see the stones rolling out towards the fundus, then you know that they're not impacted, and that they're mobile. And then the sonographic Murphys, or Murphys, is, you know, when you're doing the gallbladder sign, if they're, you know, guarding and they jerk, you know, and if you're right over the gallbladder, you can say, does that hurt? And that's going to be a sonographic Murphys if they kind of jump on that. So that positioning and breathing is very important with gallbladder, because there's no way that I can tell you hold this probe this way and you'll get these images. So just practice, 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 because most of the time these are obese patients and it can be very difficult to find everything.